So welcome everybody to this meeting of the Health and Wellbeing Board being held in the municipal buildings in Crewe. I'm Councillor Sam Corcoran, chair of this meeting today. Please note this meeting is being recorded and streamed live to the public. And can I ask people to speak clearly and speak into their microphones when speaking and then turn them off when they've finished. So we have several apologies today. We've got apologies from Michelle Davis, the housing representative, Dr. Paul Bishop from NHS Cheshire Merseyside ICB, Louise Barry from Health Watch, and we welcome Mark Groves here from Health Watch, Catherine Sullivan, CVSCE, and Kate Little is representing that. So welcome, Kate. And apologies from Councillor Janet Clowes, and we welcome Councillor Stuart Gardner. We also have apologies from Mark Wilkinson and Teresa Levy, and Claire Williamson is here from the Children's Services. Do we have any other apologies? Now, rather than going around the room getting everybody to introduce themselves, when you speak for the first time, could you introduce yourself for the purposes of the meeting and for the record? Are there any declarations of interest? Good.
In the interest of openness, issue item 7, the local association incentive scheme, this matter was presented to a committee of Cheshire East Council, the Adults and Health Committee, and at that time I did speak and vote on that item.
Thank you. And again, in the interest of openness and transparency, if I can declare that my wife is a GP in Cheshire East, I don't consider this to be prejudicial, and when we get to item 8, you'll see why I'm mentioning it. Are there any other declarations of interest? Then item 3, the minutes of the previous meeting. Are there any matters of accuracy with the minutes? Okay, so can I take a sense of the meeting? Is everybody happy with the minutes? Thank you. Now, there's one item that was down for me to do. I'm assured that the issue of whether the Director of Public Health annual report on the commercial determinants of health should go on the work programme of the Corporate Policy Committee. They meet on Thursday, and I'm assured that they will discuss that issue at their meeting on Thursday. Item 4, public speaking open session. There are no members of the public present. So item 5 is the Mental Health Partnership update on plan and priorities. We're going to receive a presentation on the Cheshire East Place Mental Health Plan. I believe it's Maddie Lowry to present this. Maddie, can I hand over to you?
Yes, thank you, Chair. Hello, everybody. For those who don't know me, my name's Maddie Lowry. I'm the Chair of the Cheshire East Mental Health Partnership Board, and I work for Cheshire Rural Partnership NHS Trust. And I just want to say that my colleague Keith Evans from Cheshire East Council was due to present with me today, but unfortunately Keith is really not very well. So I am taking it for the team, which does mean that if you ask me a complex social care question, I may well need to scribble furiously in my notebook and send you an answer via email. So just bear with me if that happens. I'd like to start by saying thank you for giving us the time as a Mental Health Partnership Board. If you move on to the next slide, please. And I'm just going to recap over the role of the Cheshire East Mental Health Partnership Board, just for anybody who's not familiar with it. We're a group. We represent people with lived experience, and there's a slide after this on that, and statutory organisations, parents and carers. And our role is to ensure good mental health and well-being for people who live in the borough of Cheshire East. And that means taking a pan-Cheshire East view, but recognising we have some significant areas of deprivation. So we might want to focus in on some wards and parts of Cheshire East more than others, but we need to ensure that the offer is available to everybody. We report in to the Health and Wellbeing Board, but we also provide updates on the Cheshire East Place Mental Health Plan, to Adults and Health Committee, to the Children's and Families Committee, and we're able to provide information and support to any other committee as needed. And we can also provide and link people to different people across the system because we have quite a good network of contacts. If you can move on. So we have partners from across health, the local authority, police, VCSFE sector, and I have to say Catherine and Kate have both attended previous Mental Health Partnership Board meetings from CPSSC. Our job is to really make sure that our plans align across the system and that we take account of each other's needs, that we inform each other about things, and that we work really closely as a partnership. And I just want to reflect on the system architecture changes that have been announced recently and say the role of a partnership board at times like this, when the system is moving, is to keep our focus firmly on population health need and on delivering on the plans that we've already made. And I think that you will see everybody who is a member of the partnership board really focused on the population during this time. Okay, if we can move on. So, for those of you who may not be aware, we have a Cheshire East Mental Health Plan. It started in 2024 and it runs to 2029. And we meet bi-monthly and we receive reports from different leads on specific actions across the plan. The plan has 6 priority areas. We normally focus on 3 in meeting month 1 and 3 in the next meeting, if that makes sense, to allow for time. And we do some deep dives. So at our next Cheshire East Mental Health Partnership Board in April, we will be doing deep dive on early intervention psychosis services and on the Healthy Young Minds Alliance work for children and young people. So we have lead officers who submit an update, and then we have a bit of discussion about the update, and people ask questions, and we link people together for specific pieces of work. We also have a risk register, and one of the last slides I'm going to show will talk a bit about some of the risks that have been highlighted. One of the strengths of the partnership board has been we have a standing agenda item for lived experience. So we can have we have representation from the Adult Mental Health User Forum and from the Parent Carer Forums. And they bring issues that are troubling them to the table, and then we take action according to how we think best collaboratively we can address those issues. And I've just covered that, I think, so we can just move on. Okay, now this is quite a busy slide. I just wanted to focus on a couple of bits in this under children and young people's mental health. And I wanted to highlight the significant improvement we've had with supporting schools and pupils through the My Happy Mind programme. So that's supporting 61 schools and 13,500 pupils across Cheshire East. And we've had some really positive feedback. If anybody wants to read their feedback report from last October, it's quite a good read. We've also opened 6 family hubs across Cheshire East, and for those of you who might be closer to that programme, you'll know that they have focused particularly on the Macclesfield and Crewe areas, which are the more deprived areas, and we've seen some good and positive reports out of that. What I did want to mention, though, is what is the data telling us? And the big thing that Cheshire East data is telling us, and we look very much at the public health data that is collected nationally and its focus on place, is that we're seeing more absenteeism in primary and secondary school. So our position on that has deteriorated, and we're seeing longer waits for neurodevelopmental assessment for children and young people. But in a good news story, we have improved the length of time it takes for somebody to have a first contact mental health appointment with child and adolescent mental health services more recently. But the issue around absenteeism in primary and secondary school is significant. And some of the discussion we've had at the partnership board has been around how we support families who are not in school and pupils who are not in school, because we've done a lot of work supporting schools. The question is, how do you get to the young people who aren't actually engaging in school? If we can move on to the next slide, please. The bit I wanted to start with on education, employment and training is if you look at the Cheshire East statistics, we're really, really good. So the England average percentage of people in employment is 75%, and in Cheshire East it's 81.6. Our working age claimant count is lower than the English average, it's 2.4%, the North West average is 4.5. And we have about half the number of 16 to 17-year-olds in NEET than we would in England. But those statistics aren't improving across Cheshire East. So we're seeing stable statistics, stable trend for the people in employment and the working age claimant count. We're seeing a rise in young people not in employment, education or training. So what that tells us is that there's work that we need to do in that area. So we've been doing quite a bit of work around senior mental health lead roles in primary schools and secondary schools, so supporting people to stay in school so that they achieve educational achievement. And we have an individual placement support service via Stand Guide covering Cheshire East. So that's looking in particular at supporting people who've been who have a mental health background of access to services in accessing employment. We also have, and I'm particularly proud of this, on behalf of Cheshire East Council, a supported internship programme for young people with learning disabilities and autistic people, which looks at bespoke placements to get them into work. And because services I manage are learning disability and autism services, I feel really proud of the work that Cheshire East is doing to provide paid work for young people. And we've seen that service grow. With 74% of the young people who are accessing that service going on to get paid work, which I think is really remarkable. We've also put a welfare to work partnership in place. If you read the news this week and you're following the government's announcements, this sort of focus is going to be an area that we're going to need to develop across Cheshire East. But I think we've got some really good foundations in place to support that. So I think it will be interesting to watch what happens next. Next slide, please. Now, I'm not going to talk for long on this because Laurie is going to do a presentation after me, which is around self-harm and suicidal prevention. So I'm just going to skip over that aspect of this. But I wanted to highlight that we have been doing a wide range of public health work around the wellbeing of children and families, including something called the Henry Programme and the launch of the Eat Well and Move More partnership. What we are seeing is an increase in the number of physically active adults across Cheshire East, but we are not getting close to where we want to be on the rate of suicide. I'm not going to talk about that, Laurie, because I think you're going to pick that up in your presentation. If we could move on. Building sustainable communities. So those of us who work in mental health know that the wider determinants of health and housing in particular, homelessness, etc., are really fundamental to getting people better. We have a specialist housing group which now meets on a bi-monthly basis, and we are actively looking at a pathway for people who are residing in inappropriate mental health accommodation. Now, the National Planning Policy Framework for Housing it has been issued, and the strategic planning team at the Cheshire East Council are looking at how they're going to develop their plans as a result of that. But I did want to talk on domestic abuse. So we have put additional support into the custody suite intervention offer. So that's now 7 days a week with really good outcome from that. And there's been a pilot scheme around domestic abuse called the Whole Housing Approach. Now that pilot scheme concludes this month, but there is a formal evaluation from the University of Lancashire around whether or not that scheme has been effective. And following that evaluation, we will be deciding whether or not that scheme will move forward. Just to show you on the stats though, we have Cheshire East as a whole has less homelessness than the English average, but again, that's a deteriorating trend which we need to reverse. And in terms of adults in contact with secondary mental health services who live in stable and appropriate accommodation, we have a trend in the statistic for adults with learning disability, which is a very high statistic in comparison to other areas. But for general adults, it's 54%, and we don't know what the trend is because that's not being collated through fingertips public health information at the moment. I do want to say that we have revised our hospital discharge protocol recently to look more at housing, and we're hopeful that that's going to support more stable discharge, less revolving doors into hospital. Move on. So in terms of transformation of mental health services, and this is where the partnership between the local authority and CWP has been really beneficial. There is now a floating mental health support service through Making Space, which operates across Cheshire East, and a low-level mental health pathway has been extended by the council following an evaluation, which is really positive. For those of you who are aware, there are advanced roles responsibility workers who are available to work in mental health, but based in primary care, working across a primary care network footprint. They're not available in all 8 of the care communities across Cheshire East yet, partly because PCNs can choose whether to fund one for mental health or to perhaps fund a different area, but they are making a difference in the places where we have them. We have managed to implement the 4-week waiting time standard in adult community mental health, which means that the referral to first contact is now between 1 to 3 weeks, which is really good across Cheshire East and a significant improvement on where we used to be. We've agreed the strategic model for personality disorder pathway. We had a deep dive on that in our Mental Health Partnership Board meeting in February, and that's due to commence in East across spring. We've also recruited some outreach support workers to support autistic adults who are either waiting for autistic assessment or following diagnosis, and those people will be working half of their time in Space for Autism, which is a local charity in Cheshire East, and half of their time for CWP, with a real emphasis here on being out in communities, supporting autistic adults to stay well in the community and not escalating to crisis. So some key stats that I just wanted to highlight for you. Obviously, the improvement in referral to first contact waits for adults, but I do need to highlight that, as with children's services, access to neurodevelopmental assessment remains counted in months, and we're talking between 21 to 23 months on average for access to an ADHD or an autism assessment. And before anybody asks me this question, this is a national problem. Everywhere in the UK is grappling with the high demand for ADHD and ASD assessment at the moment. And from a system perspective across Cheshire and Merseyside, we're involved in a number of conversations around how we're going to manage this moving forward, particularly with development of a pathway that will stem through needs-led services in the voluntary and third sector, through primary care, and then using secondary care only for people with more complex presentation. But those are the conversations that we are having at the moment. So our last priority is clearly crisis support. And I happened to glance over at Superintendent Blizzard at that point, because he will be very familiar with the pull on the police when people go into crisis. We've had some really good news stories around our Children and Young People's Urgent Support Service across Cheshire East, which is now working into the acute trust and the emergency departments. We've also put in place Ancora Care, which looks at admission avoidance for young people and facilitates earlier discharge from hospital, because most young people will do better being supported in the community. The area that we really need to focus on is self-harm for young people aged 10 to 14 years and a little bit older, where we've seen a significant spike in numbers across Cheshire East. Young people intentionally self-harming and being admitted to hospital. With the ICB support, we've done a deep dive into that and some actions are being taken. In terms of community adult mental health, we've reviewed community crisis beds. We've decided to keep our crisis cafe offer. which is supported by information leaflets in a range of languages, recognising the disparate population we have across Cheshire East. And there is now the launch of the NHS 111 option 2 offer alongside our crisis telephone line. So if somebody dials 111 but they're experiencing mental health problems, previously they'd have been asked to dial a different number, but they can now select option 2 and get through to services, which is really good. We also now have mental health responsive vehicles live. So they're crewed by a mental health nurse and an emergency technician from the North West Ambulance Service. We've got them based in Northwich and Bebington. The next big step is the development of the Urgent Treatment Centre at Chester, and we are bidding for funding to develop an urgent treatment centre in Crewe, which we're hopeful we might get in this round of capital planning. The key stat that I want to highlight, aside from the young people's presentations in self-harm, is that we've actually seen an improvement in emergency hospitals admissions for intentional self-harm overall ages. But we have really got to focus on those young people where we've seen a drop in numbers. Keep going. So we've got 3 risks that are more high scoring at the moment on our risk register. And I thought it would be worthwhile just highlighting those to you as a Health and Wellbeing Board. We have smaller rural schools, so this is schools with a very small number of staff who are finding it difficult to release staff to access mental health support and training that is available. And we've done a bespoke piece of work to engage with those schools. Support for carers of all ages, this has been raised by the Parent Carer Forum, is not being delivered as planned and according to statutory responsibilities. And we've done a piece of work through the council with Making Space. This is around people actually accessing carers assessment in a timely way. And we've had a number of conversations around that, and we hope that the system is improving. And then lastly, clearly, the increasing number of children and young people presenting with self-harm at acute units, with concerns being raised by the Carer Forum about increases in self-harm behaviour across their community. I think that's it. Just go on to the next question. I think what I would stress to people is our plan is a long-term plan. It's a 24 to 29 plan. It's going to take time for us to turn those statistics around. And we were very clear at the start of the plan that we need to track lead and lag measures in terms of public health data, but we need to be led by the data, and we need to respond to emerging trends that are coming out. I think our focused attention has been on improving support for carers, recognising that if we get it right for carers, we often actually enable carers to better look after the people they care for. Thinking particularly about rural and isolated schools, and then continuing to address waiting times for both children and young people and adults. I'm happy to take any questions.
Thank you very much. I noted your comment about it being topical. I often compliment Guy Kilminster, who puts together our agenda on the way he does it. Quite how he knew that mental health was going to be topical for this meeting, I don't know, but thank you. I would also echo our former Director of Public Health, who said several times that mental health and physical health are inextricably linked. And I saw priority 4 is about homelessness. So I would encourage all Cheshire East councillors to attend a briefing on homelessness and rough sleeping on the 9th of April. Thank you. Councillor Gardner, do you have a question?
Thank you. A very interesting presentation. Obviously, I'm a visiting member, so please forgive me if these matters have been raised before. Firstly, I know that you're saying that we're basing expenditure, etc., on the deprivation indices. And I wonder whether or not the incidence of particularly younger persons' mental health problems, the data is following in terms of the occurrences, are appearing in where you would expect them to be given those indices. With regards to your indications about wanting to have a facility within Crewe, I'm assuming you mean as part of the Leighton expansion. And are you in detailed conversations? Because the presentation I attended last Friday would suggest that it's not part of the Department for Health's programme for the site. And thirdly, with regards to rural schools, the person I am subbing for would kill me if I didn't mention this. What actions are you taking? Because quite clearly, if you have a school which has a very small number of staff, if they were to allow someone to go off a day for training, the implications for their budget are far greater than they would be if it was for a school, say, with 24 staff. So I'd like those 3 questions, please.
Okay. Deprivation and disease in children and young people and self-harm. What we've actually looked at is we've been looking at whether or not those young people are in school, whether or not they are coming as children in care, and whether or not they are children with SEND. And what we have actually seen is we have a high preponderance of children in care who are presenting with intentional self-harm. We haven't looked specifically at areas of deprivation because we've been looking at it through the lens of the presenting, particularly that their nurture and their attachment and their home life at this moment. So I've not seen any data that shows it by ward. What I have seen is data that says actually what we've got is there was a concern that it was a high proportion of children with SEND. Actually, it's a higher proportion of children in care, which I think is important. Leighton expansion, I feel unqualified to be able to answer that definitively. So, Councillor Gardner, I will defer to Isla.
Do you want to carry on, Maddie, and I'll go back to Isla in a minute?
Yeah, that'd be great. Rural schools, I would like to refer that to the person who's leading that piece of work, who's in Cheshire East Council. So as I said at the beginning, I might not be able to answer that. Oh, I've got somebody else in the room who might be able to answer that one. Marvellous.
Right. Thank you. Yes, we do have a wealth of talent in the room. If I can go to Isla Wilson first. Isla, do you want to introduce yourself and then see if you can answer Councillor Gardner's question?
So Isla Wilson, the Chair of Cheshire Rural Partnership Trust and also the Chair of Cheshire East Health and Care Police Partnership. And I think that's the meeting you're referring to from last week. So the conversation we were having in that room is about the Leighton redevelopment. As part of the slide that many of us will have seen, multiple times, there is some master planning for that site, which references mental health facilities on site, among other things. That's a plan for what it could look like. It's not a plan that is funded or agreed or happening. So separately at CWP, we are involved in looking for funding under the capital programme for an urgent care centre that would replicate the work that's happening in West, which we talked about in that room, and follow some of the work that we're also doing in Wirral on a similar approach. It's the right approach to take. It would massively transform the services. That funding will mean that we will then need to look for a site. We may be able to put that on the Leighton site, but obviously there's a huge amount of work to do on their first phase. And it might be that we're in a position where to get these facilities in the time period that we need them, we have to look for alternative sites. And it may be relevant to the conversation we're having because transforming how we deliver those services is required to deliver what the new hospital at Leighton needs to do. So there are assumptions there about the level of need that require a different way of delivering services. So it's a very fudged answer, but really the applying for funding to build this is completely unrelated from the fact that there will be a new acute hospital on the Leighton site.
Thank you. And also to make the point that the new Leighton Hospital is going to be a regular item on the agenda of the Health and Wellbeing Board. Claire Williamson, do you want to take the final question?
Yeah, thank you. Claire Winston, Director of Education in Cheshire East. So obviously was really interested in the presentation. Thank you. To answer the councillor's question in regards of how are we supporting all of the schools to access training in regards to mental health and wellbeing, it's first and foremost about access. So it's about us ensuring that when the training is on, that it's not necessarily in the school day, it's afterwards. It's obviously it's online, it's so that all those schools can access that. And we've been working with the schools to take that feedback and ensure that that is an absolute priority. Also part of your presentation, I just think it was, given that obviously I oversee this data, I do think that some of the data is a little bit outdated, and I do think that just so that board members have got that update in regards of priority to our NEET figures in regards of children and people around education, employment and training. As of November 21, our NEET figures are not known is 3.6 compared with an 8.6 nationally. If we just look at NEET, actually the figures are 35%. There is a growing cohort around NEET, and we know that we do need to do and look really at focus around 17-year-olds. Our 16-year-old data is looking really positive in regards of destinations and those children and people in employment, 96.1% favourably against a national 94. So I just think we just need to be really clear when we're putting presentations, just making sure that we've got the most up-to-date data. And then supporting that presentation, absolutely, in regards to self-harm is a priority that we're concerned about, and that's what we are seeing in regards to school avoidance for a high number of students at this moment in time. And actually when we are seeing that ever-moving trend around children with SEND and care leavers, and that is absolutely increasing. So it's something that we do need to monitor as we move forward.
And thank you, Councillor Godwin. You've given me an opportunity to look up the tartan rug and to mention the tartan rug again, which you can search on our website. Item 29 is hospital stays for self-harm, and it does give a very clear visual confirmation that it is related to deprivation. There's a clear red band where crew is. Now, it might be worth looking and seeing some of the other areas, because it's not absolutely related to deprivation, but there is a clear correlation. Are there any other questions?
Councillor.
Are there any other questions?
For giving that answer.
Carol?
Thank you, Chair. Thank you, Maddie. I was just wondering about I think I was just touched on it, absenteeism in primary and secondary. I suppose it links to all sorts of things, but the figures are 23, 24, aren't they? Was it 22, 23? And I just wondered if, I know that, and Claire knows that Sally Ashwood and people like that doing a lot of work on this from Treasury's point of view. And I wondered if the trend was perhaps a bit more positive now.
So I'm going to say to you, sorry, I've gone with the data that my public health colleagues have said that they are happy for me to present here today. So there may be some local trend data that the council has, which might be more recent. So I've already written in my notebook that I'm going to be contacting Claire after this to find out where she gets her data from, because I've just been going with the data I've managed to get out of other colleagues. So can I take that question and take it back to the ranch? And Claire says she can answer it actually. So Chair, would that be okay?
Right.
Yeah, absolutely. So in regards of attendance and persistent absence, we are seeing a trend in regards of seeing a higher level of children coming through. We've got a set of interventions that we're putting in place to support parents. We are seeing around mental health and those concerns as causes of persistent absence that we are seeing across our children and young people. But it is a improving picture. You know, there's a lot of things that we're doing together across the services with public health and colleagues, etc. But yes, we are seeing that as increase.
No other questions? Are we happy to note the update? Right. Thank you very much, Mary. Moving on to item 6, the Self-Harm, Suicide and Prevention Action Plan update. We have Laurie Hawthorne to present this. So can I hand over to you, Laurie?
Thank you. Laurie Hawthorne, Public Health Improvement and Suicide Prevention Lead Officer. So we hosted an online workshop on March the 4th with the partnership. We had around 40 of members of the Self-Harm Suicide Prevention Partnership that attended and other members of the workforce. And we looked at an evaluation of the 2023-2025 plan. So these series of slides will go through some of those evaluations, and then at the end we'll talk about the priorities for the next action plan, which is the 2025-2027. Next slide, please. So Guy Kilminster's here today. He's co-chair of the Self-Harm Suicide Prevention Partnership Board, and also I'll mention Dr. Susie Roberts, who also is co-chair, but she's absent today. So Guy was welcomed the online workshop and gave some feedback on the previous 2-year action plan, which we've had evident that the partnership has shared a commitment to drive the suicide prevention in Cheshire East. Next slide, please. Just mentioning the governance, so the action plan feeds into the Cheshire and Merseyside Suicide Prevention Strategy, which is the 2022 and 2027, and that also feeds into the National 5-Year Strategy, which was published in 2022. It does feed into the Health and Wellbeing Board and the Joint Local Health and Wellbeing Strategy. Next slide, please. That's just the range of content, so I'll skip over that for your next slide. So an introduction to the action plan. The action plan is a public-facing document. It's found on the Live Well site. It was endorsed by the Health and Wellbeing Board back in 2023. The key priorities which link with our Cheshire and Merseyside strategy and with our national strategy, these are groups that include men, children and young people, and self-harm. Next slide, please. So the partnership meets every quarter, so every 3 months, and we discuss the action plan, which is reviewed by members of the partnership. Professionals include the NHS, social care, education, lived experience, police, voluntary sector and safe sector. Members have an opportunity to review the action plan, and the agenda items are evaluations of updates from the ongoing actions. Next slide. Collaboration. So we attend the Cheshire East Mental Health Plan and give an update in relation to the early intervention and prevention, which Maddie has focused on today with the mental health plan. So it's a strong collaboration, and it gives us opportunity to work together and avoid that duplication and a real partnership approach. Next slide, please. Some data. So just to mention that you can find data from Zero Suicide Alliance, which is public facing, and it gives you up-to-date data from local authority England and national suicide rates. We are aware that we are high on suicide rates, but as you can see here, North East and also other areas of North West are high for suicide rates. So you can go on to that and have a look at that. And through the workshop, we did sort of like explore the website. Next slide, please. So just to drill down to local data, this gives you a picture of the last, well, it's from 2001 to more recently 2023. So the last 20 years, you can see the picture compared to England's average and where Cheshire East sits with suicide rates, which has been up and down. But sadly, at the moment, we are concerned about the rates of suicide as we're higher than England's average. Next slide. As Maddie alluded to with the self-harm data, additionally, we are concerned with rates of self-harm. You can find more information from the Joint Strategic Needs Assessment in the emotional and mental wellbeing in our children and young people, JSNA, which identifies that we know that there's a
an increase of presentations for self-harm in the younger children of age 12 to 15-year-olds. Next slide, please. So moving on to the workstream progress and evaluations from the action plan. Next slide, please. Men's mental health. We had a small pot of money which came from Cheshire and Merseyside Champs, and that was to fund men's mental health and in particular services to provide support in the farming rural communities. So the project included Men's Health and also Lightworks project, which is a faith sector organisation in Audlam. So both project evaluations were positive and achieved successful community engagement and uptake of support groups in the area. Next slide, please. Another update is with children and young people, which is a priority, as I've already said, and we're looking at early intervention and prevention in primary schools. So we have a pilot which is with 8 of the primary schools over Cheshire East, some in areas of deprivation, some not, but it's quite a nice, it's across Cheshire East. So what we will look at is a framework where we will use plans. So we'll identify struggling, coping and keeping safe as key aims. So this is an ongoing piece of work. The evaluation is due towards the end of the year, and the plans are for children to keep on themselves, and the teachers will talk through them. Next slide, please. Another piece of work which was launched in May 2024 is the Suicidality and Domestic Abuse Toolkit. This was developed by a multi-agency group and launched in May last year. The toolkit has been shared with other local authorities, and we've had opportunities to share this best practice, and recently at the Lincolnshire conference in this month. The idea is to help the workforce identify domestic abuse and also suicidality, and to ask those important questions around suicide if somebody is experiencing domestic abuse. Next slide, please. Self-harm awareness training. So we are looking at developing some training which will sit with the Healthy Young Minds Alliance, and that is to raise awareness around self-harm, understand how to respond to self-harm, and we'll be looking at delivering that training to children and young people's professionals and targeting schools, school staff and other professionals. Next slide, please. So we have the ongoing suicide prevention training, which is delivered every couple of months. It's still a successful training and very popular. I delivered it last Friday. We had over 30 attendees that attended the training. So we've just put down some of the survey feedback. So knowledge and awareness before training on an average of the surveys was 5.3, and after completing the course was 7.9. And then you can also see the increase in confidence as well, which is from 5.0 to 7.7. We do also promote the Zero Suicide Alliance e-learning modules, which is a range of different training, which is on the LiveWell site. Next slide, please. So we had a suicide prevention online conference back for World Suicide Prevention Day, which was really successful. Those slides are available on the LiveWell site, and we had a range of different talkers, some with lived experience, some bereaved by suicide, and some new services which are available in Cheshire East. Next slide. So the new services included the Martingalia project. This is an intervention support service which offers support to those who are feeling suicidal. It's only recently been in Macclesfield. It's quite established in Crewe, and it's been there for about a year, and recently in Macclesfield. So both of those services offer that support for people who feel suicidal. Another organisation is To Wish. They offer support for people that are bereaving a sudden death of a child or a young person. And then just to mention the I Thrive system framework, which is a new initiative which we've been involved in, and that's over Cheshire East. Support after suicide. So we have a commission service called Amparo. Amparo is our immediate support service when somebody is bereaving somebody who's died by suicide. So some of the data, 75 people receive support between April 2023 and December 2024. We also have a lived experience peer-led support service called SOBS. That's based in Crewe, and we have a new group which was introduced in December 24 in Macclesfield. Further support when people, when schools are bereaving a suicide or a suicide attempt is from Samaritans. So they offer something called the Next Step, step-by-step service, which they will go in and support the senior leadership team and give support to them to cascade that information and support to other members of staff. Next slide, please. So community engagement. We've done quite a lot of work with our local Samaritans branches. So we have one in Crewe that we've worked closely with and one in Macclesfield. And they are fundamental when it comes to suicide prevention and support. They've attended a number of wellbeing events and gave out like cards, resources. What we want to continue to do is encourage resources and digital signage in public spaces, so doctors' surgeries, pharmacies, hospitals, train stations and shops. So Network Rail, who also Samaritans work closely with Network Rail, and that's they already have a support which they have in place. So we work closely with them around if there's any suicides in train stations or rails, and they offer that support. This work in Cheshire East has included supporting the station staff, training and awareness and assessment of safety at stations. So there is a rail industry suicide prevention programme, which is, there's some more information there. Risk assessments on new bridges has been completed following the guidance of the 2022 National Highway Strategy. And that's something relatively new. And we've been invited to look at risk assessments for bridges. There's one in Cheshire East, which we've been involved in that suicide risk assessment. Next slide, please. So the continued actions from 2025, the key priorities still will be to focus on groups with men, children and young people and self-harm. So a number of the priorities I've spoken about will continue in the next plan. And that will, next slide. And that will, and we did also look at reflections and any other priorities which we may have missed or any other pieces of work around suicide prevention. And collected a number of comments from the workshop. I think that's it.
Many thanks for the report. I would commend the suicide awareness training. It is available free on the either through the Live Well site on the Cheshire East website or through the Zero Suicide Alliance. I remember going through that and being surprised that it recommends if you think somebody is considering suicide, ask them. Have you thought of killing yourself? It's quite a challenging question to ask. And of course, think about what you would do if they say yes, the training will help. I do have one question. It was quite dramatic, the jump in suicides in Cheshire East just recently. We were below the national average and we've gone above the national average. Do we have an indication as to why?
That has been asked, and I think that when we are going to be doing a suicide audit and looking and taking more of an approach to look at the details around suicide, but when we receive the real-time surveillance, it's a number of risk factors, so we can't identify one in particular. What's been discussed at the Cheshire and Merseyside suicide prevention groups is that the cost of living could have an impact, and also the post-pandemic are factors that could be why there's an increase in suicide rates, because it's not isolated in Cheshire East. we know that we have an increase over North West and Cheshire and Merseyside.
Right, thank you. Now, we are asked to not just note progress made on the 22-23 self-harm and suicide plan, but also we're asked to comment on and agree the 2025-27 plan. So I'm going to ask in a minute somebody to formally propose and second that we do that, and we'll take a vote on it. But Claire, did you want to come in on something?
Yes, I just wanted to comment, obviously seeing the Network Rail and putting that in the presentation. I just wanted to give broad assurance that there has been some high profile deaths on railways in Cheshire East. And I just wanted to give assurance to the board that we've been working with Network Rail and they've been doing a dedicated targeted piece of work in our high schools around a particular area in Congleton. So just to give that assurance to board in recognition of that.
Guy, did you want to say anything about the 25-27 plan and the progress it's been through to get here?
Only that it's the culmination of the work of the partnership board that Laurie's already talked about. Some of the activity and the actions within it are rolled over from the 23-25 plan, but there are some additional areas of activity. But because of what we've heard from both Maddie and Laurie this morning, clearly self-harm is a concern as well as suicide prevention. So we'll be trying to ensure that we at least stabilise the figures on both before getting them to start moving downwards, hopefully.
Thank you. So can I formally propose the recommendations on page 24 of the packs that the Cheshire East Health and Wellbeing Board note the progress made in relation to the 2023 to 2025 self-harm and suicide prevention plan, and to agree the 2025 to 27 plan. Is anybody willing to second that? Seconded. Anybody wishing to speak on that? Carol?
Thank you, Chair. Just a comment really about one thing I do know about Mentel. You commented that their approach in terms of engagement with the community was good, and I totally agree with that. I've been round with them around our area and watched and listened, and I think that it's a really brilliant way of approaching this. I'm glad that, I mean, people do follow up, don't they? So it's a casual first approach, but that people follow it in their own time, follow up if they need it. And let's hope eventually that might have some impact on suicide. Thank you.
We are looking at expanding and helping Mentel to expand into other towns. They are based in Congleton, Macclesfield, Crewe, but you're right, they have the online circle, they have face-to-face circle, and that they really have increased their visibility in Cheshire East over the past 2 years, and they're really, the positive part of the partnership. Thanks.
Mr. Gardner, Stuart.
Firstly, I should declare an interest. Probably 2.5 years ago now, I had cause to use the services of Cheshire and Wirral Partnership, and they were absolutely excellent. Also, for purposes of, I suppose, giving a background, I was suddenly confronted with wanting to end my life out of nowhere. I had no idea what was going to happen. I was in a happy life, I was in paid employment, I thought everything was hunky-dory, and one day I wanted to drive my car into the canal. I was in Warrington, and I had no idea where that came from. Luckily, my husband picked up on it, and I received the necessary help that I required. But I'm just saying that I think sometimes we think that the indicators are there and we know what sorts of people want to take their own lives, and in reality, perhaps even those people themselves don't realise until it's upon them. The other point I would raise is that obviously, by necessity, facilities can only be in certain places because we've only got so much resource. But perhaps the advertising of those services could be via town and parish council boards, because particularly our rural areas, it's probably something where they might pick up. There was a notice on doctor's surgeries, I'm afraid. unfortunately, there are so many notices on the board that you might not necessarily notice them, but if you sort of put a notice on a parish council board, that might actually, somebody might see it. And we are aware that obviously within the rural community, particularly amongst farmers, there is a higher than national incidence of male suicide. So I think that might be a helpful thing.
Okay. Thank you for sharing that. Maddie, did you want to come back?
To say, firstly, thank you so much for sharing your story, because it's really powerful, and that's a story that we hear in mental health services and from people who maybe don't have a history but enter into crisis very suddenly. So it's really powerful to share that. Thank you. Secondly, at the moment, we're as a trust, we're looking at doing a pilot piece of work with a charity called Chasing the Stigma, and Chasing the Stigma run what's called the Hub of Hope. Now, some people will be aware of what the Hub of Hope is, but the Hub of Hope is a online collection of local resources and signposting for people. And if we contract with them, they will do a huge billboard campaign and advertising in very local areas, which is not necessarily just about CWP. And I think this is the point, Councillor Gardner, you were raising, which is sometimes people know that there are a range of services around for them. And the right service, as Councillor Bullman just described with Mentel, is the one that somebody feels able to access. It's the conversation with the person that they feel able to have the conversation with, which might not necessarily be the hospital trust down the road. And that, so I just want to let you know that that is something that we're actively pursuing at the moment, with a view to contracting some work across Cheshire and Wirral in the next financial year, to see whether that approach, which is more generic and is aimed at mapping all of the VCSFE support, etc., very much like LiveWell, but flagging it in a slightly different way has an impact.
Thank you. Right. Dr. Matthew Atkinson.
Yeah, I'm going to say something just because I'm speaking on the next item. So I was one of the 75 people supported by Amparo last year after I lost my dad to suicide. And I did want to say that they are a very good service, and I was very well supported afterwards. And also I attend the SOBS service in Crewe. And what I would say about that service is we're very good, and we probably don't get enough people through. Given the number of suicides that we have in Cheshire East, we would expect more people to be attending that service. So just to plead to colleagues in health and in the police, for example, just remind people that that support is out there afterwards. And when people are ready, then it can be very helpful.
The recommendations on page 24 have been proposed and seconded. Before I just go to the vote, we have changed our terms of reference recently. So if you're in any doubt as to whether you can vote, you probably can. So all those in favour of those recommendations, please show. Any against? And any abstentions? So that was carried unanimously. Thank you. Then moving on to item 7, the Smoking Cessation Incentive Scheme, and it's Dr. Matthew Atkinson. If you'd like to introduce yourself and then introduce the item.
Thank you. Yes, hi, I'm Matthew Atkinson. I'm a consultant in public health, and we were asked to take a version of this report on the smoking incentives for the cessation of smoking for pregnant women to the Adults and Health Committee in January. And then it was requested that we brought it here also. So we're providing an update on the pilot project to offer incentives to support pregnant women to stop smoking. And we knew that there was a real need to intervene here, because smoking has potentially disastrous consequences for babies and children. And board will be aware that it's frequently raised as a contributing factor when we review child deaths as part of the child death overview panel. Cheshire East has had higher rates of smoking at the time of delivery than England overall, and it's quite a rare example of when our area is worse than the national average. So the scheme was introduced in early 2023 and it offered a staggered approach to support where pregnant women could receive up to £400 in shopping vouchers for participating and remaining smoke-free. But over the course of the project, there were significant changes in how it was run and the national landscape around support for pregnant women to stop smoking. So the smoking cessation support shifted from our commissioned one use service over to being directly delivered on our maternity units during the course of this programme. Also, our overall rates of smoking at the time of delivery fell, which is obviously very welcome, but it does mean that those remaining might be slightly more resistant to change. A decision was taken nationally to introduce an incentive scheme for pregnant women recently as well, and both of our acute trusts are going to take up that offer and join that national programme to incentivise pregnant women to help them stop smoking. So it's fair to say we've not had quite as much activity as we would have liked, but for those who have set a quit date, the quitting rates are comparable to other similar schemes run elsewhere, for example, one in Glasgow, with over 1/3 of people being newly smoke-free after 4 weeks. The long-term follow-up data isn't quite as strong, and there's lots of reasons for that. Some people are lost to follow-up and don't wish to be contacted anymore. Some people, unfortunately, lose their pregnancies, for example, and therefore we don't follow them up further on. So we have lost track of people over time once they've joined the scheme, but the initial results are very encouraging, and we hope that that means that they'll be able to remain smoke-free. In addition, some of the people who are referred do recognise the need to stop smoking, but feel that they can do it of their own accord without the need for the incentive scheme. With the focus being on pregnant women, we had very few referrals for the second element of the programme, which was for household members, but we're now moving into a new phase. So with the activity to date, we're going to undertake an evaluation of the scheme, which will include qualitative feedback from staff and service users, and we'll present that back to Adults and Health Committee in the autumn. And we're obviously shifting our focus away from pregnant women with the introduction of the national scheme, and we'll now be focusing solely on household members who smoke. And therefore, we'll be undertaking quality improvement activity to increase the numbers of people who pass through that service and benefit, to try and get whole households smoke-free and deliver the best benefit we can for our young people. So that report will come back in to Adults and Health Committee and the Council in early 2026. Any questions on that?
Councillor Jill Rhodes.
Thank you. I think this project's done very well and highlighted as an issue, but mine's really about the future, because we're increasingly seeing people vaping, not just people trying to not smoke, but people actually taking up vaping, particularly worrying for young people. And I know the National Health is currently looking at some trials about the effects of vaping. So I just wonder if this scheme might be extended to vaping in the future.
So at the moment, the position is, if you smoke, vaping can be safer, but if you don't vape, don't vape. You know, if you don't smoke, don't vape. It is not a safe product. It is just a harm reduction product to help people quit smoking. We do not know the long-term effects yet, but there is emerging evidence that vaping is harmful, and we are concerned about nicotine addiction, particularly in young people. Liverpool, I believe, has just opened a service for young people who vape to help them quit. And I think it has been specifically discussed in the recommission of our one new service. Guy, I don't know if you happen to have the detail of whether vaping is what the changes are in in vaping in the new one you recommissioned?
It's as you described, Matt. So there is no service for vapers, but if people are not smokers, then they are strongly urged not to vape if they approach the service. But there isn't an actual service for vaping cessation as of yet.
So I think what we understand so far about vaping is it's most of the harm is to the individual. We certainly don't have the evidence around the passive smoking harm, the increase of sudden infant death that might be associated with household vaping yet. I hope that evidence doesn't emerge. If it does, then it's something that we need to look at very strongly.
Thank you. Claire Williams.
Yeah, just to add to that, we are really concerned in regards to the levels of vaping that's happening in schools. In fact, in regards to the Safeguarding Education Board yesterday, it did actually get raised as one of the most significant concerns that head teachers are raising. And it's not just that the vapes are being used for nicotine, but actually for other substances as well. It's really causing a real concern in Cheshire. So I would want to work with public health colleagues to ensure that we do keep that high on the agenda, because we are mostly concerned about that.
Thank you. If I could comment on this, firstly to say I'm delighted to see this report come here. I know it's been to Adults and Health Committee as well, but I can remember when we first brought this forward, it was quite controversial to pay people to give up smoking. And it's great to see that a national scheme has now taken over what we were doing in Cheshire East. So thank you for bringing this forward. We've led the way here. I would also comment, there was a very interesting article in the British Medical Journal in January saying, do smoking bans work? And the answer was surprisingly mixed. They worked in the UK, but in other areas of the world, they haven't been as successful. So it's really good to see here is an intervention that has worked. And I do have a question on this and it does relate also to vaping. I was very struck by a presentation by Professor Chris Whitty when he was very condemnatory of vaping, saying, why on earth are we letting children take up an addictive habit which is not good for their health? And as has been said today, the only positive purpose for vaping is to stop people smoking. The January BMJ article that I mentioned, in other countries, they were finding that vaping was being used as a gateway to smoking. So doing exactly the reverse of what was being intended here. So yeah, thank you for bringing this forward and pushing for the next step. What we're moving to is to encourage other people in the household to give up smoking. Is it going to be the same levels of payments to those people?
So at present, it's £200 per household members, as opposed to up to £400 for the pregnant women. We haven't planned to review that at the moment. The evidence base isn't quite as strong for household members, and therefore it's slightly more experimental. But we felt that it just seemed to make perfect sense that in order for a child to be protected from the effects of secondhand smoke, every person in the house needed to stop smoking. So it was difficult to defend not doing it. So that is why we introduced the other elements. £200 was based on some consultation activity that happened at the outset of the scheme, and we haven't had any feedback to say that it's insufficient yet.
Many thanks. Are there any other questions or comments on it? And then we're asked to note the report and to support the continuous improvement of the scheme as it evolves and progresses. Are we happy to do that? Right. Thank you. Thank you, Dr. Matt Atkins. If I move on then to item 8, which is the Better Care Fund plan for 25-26. So we're asked to receive a report for consideration and approval so that the Better Care Fund plan can be implemented. Is it Alex Jones to introduce this item?
Yeah, thank you. So Alex Jones, BCF Programme Lead. So we've attached the plan and sent that to colleagues. In the plan itself, it includes the update nationally around the aims for 25-26, which is care closer to home, prevention for independent living and use of digital technology. The objectives mirror those aims that have been set nationally. The metrics of the plan around emergency hospital admissions, average discharge delay, long-term care home admissions for over 65s. And then the paper also notes the national conditions around a jointly agreed plan, meeting the objectives, comply with funding conditions, oversight and support. In the plan as well, it also notes the local BCF priorities, mirroring those national ones. Included in the plan as well, we've listed out the schemes. So a key aim for the plan for this year was to rationalise the number of schemes, just to make reporting easier, to track the benefits and to make it more impactful more generally. So last year we had 49 schemes, this year we've got 25 schemes, and we've rolled a number of schemes into sort of headline schemes. We've mapped the schemes against discharge pathways as well, so we can track the impact more easily. If I just run through the plan as well, so we've listed out how the plan links to strategic priorities. The other programmes are impacting on this as well in terms of Home First. In terms of governance, so we've had approval through Adults and Health Committee last year to extend our agreement for this year. We came to informal Health and Wellbeing Board on the 24th, and we had a drop-in session with the national team. We've received good feedback on the plan so far, and then we've got to submit our formal plans by the end of this month. And I think that's everything just in terms of what's covered in the paper, and then I'll just sort of open up for questions if that's okay.
Thank you. And again, I will be asking for a formal vote on this at the end because we are asked to endorse the Better Care Fund plan for 25-26. I've got a few comments and questions I wanted to make on this. Firstly, to set the background, I was struck in a previous conversation that it was said that being in hospital for a long period is very bad for your health, particularly if you're elderly. Your muscle strength reduces, your independence reduces. I've even heard it said that keeping someone in hospital longer than necessary is harming that person. So I'm pleased to see the emphasis on stopping people going into hospital in the first place, as well as on work being done to getting people out of hospital as soon as they're medically fit for discharge. So the questions, I've got two. The first one is, it's very welcome to see the 3.9% increase in funding for the BCF. It's above general inflation. But what is the rate of inflation in the care sector? So not the general rate of inflation, but the rate of inflation in the care sector. So are we actually getting more money to do things, or is it actually a reduction in what we can do by having a 3.9% increase? And the second question is, what's Cheshire East Council contributing, as we have a very strong emphasis on prevention and the Home First principles that are outlined in the report? Is anybody willing to take those questions? Alex?
Yeah, so just in terms of the increase in funding, so as you noted, 3.9%. The local authority has done lots of work on this in terms of care market fees. So national living wage, there's been a 6.7% increase there. Operational costs have gone up 2.5%. And there's also been employee contribution costs have gone up as well. And general research indicates that it's about 5.6% last year in terms of that increase in costs for the care sector.
Thank you. And the contributions from Cheshire East Council?
Yeah, so just in terms of the overall financial package, so it's about £50 million worth of funding. £26 million worth of that is council, and the sort of the key tenet of things that we're working on this year are around the discharge to assess pathways, specifically around the beds, and these are funded from the council, from the ICB, as well as enacted by the trust. So that's a sort of key area of contribution this year. And then on a scheme level, it's schemes such as the Transfer of Care Hub, where we've got a range of professionals working together. And And more broadly, on a scheme by scheme basis, any recommissions would also be across partners. So we've got one for British Red Cross at the moment. The same will be happening for carers. And we've also got one for St Paul's as well. So those are sort of at a scheme level and at a programme level.
Thank you. I've also got two scenarios I wish to raise for discussion. They might be more relevant to the NHS people. There are two scenarios. First one, 80% of people say they want to die at home, but only 20% of people do. So what's being done to make sure that people have lasting powers of attorney and clear instructions as to what they want, so they don't end up being taken into ITU in hospitals? And secondly, at the other end of the scale, what about a person who is off their legs on a Friday afternoon? Who is going to make sure, or how do we make sure they don't end up in hospital? Because hospital is the only place where they can be cared for over the weekend.
I think just in terms of the lasting power of attorney question, myself and Dan McCabe have got a meeting with Leslie Hilton, end of life lead, so we can come back with a sort of a more considered response for that one. And then in terms of making sure around emission avoidance, so I just note the recent work around, we've got a UEC improvement programme, and sort of, again, key subparts of that are around emission avoidance. And I noted the discharge to assess programme that we're doing. We had some engagement events with partners last week, and they recognise the difficulties around 7-day discharges. So with that, more specifically, we were saying what's happening currently and what do we want it to look like in the future. So that was one of the key things that we were going to look at, was that 7-day discharge. And as noted, that UEC improvement programme noting the work around emission avoidance.
Thank you for that. Are there any other questions? Mark Groves.
Oh yes, I'm Mark Groves. I'm the service lead with Healthwatch Cheshire East and Healthwatch Cheshire West. I just wanted to make the committee aware that we have currently got a discharge process report being finalised in relation to the East Cheshire Trust, and that should be published in the next month or so.
Thank you. Professor Thompson.
Thank you, Chair. It's in relation to your question about preferred place of care. There is some work that's being done jointly by colleagues across Cheshire and Merseyside in relation to reviewing the data that you've talked about. Part of the element of it is recognising that someone may identify their preferred place of death, whether that's at home, in a care home, or in a hospice, but the circumstances change because of the nature of the illness that they have. So part of the review is to check whether the weakness in the system is that linked to the illness that's causing the reason for death, or it's a problem with the system not being able to support. So that work is going on, and we would hope to be reporting before the end of the year.
Right, thank you. Are there any other questions or comments? Guy?
Just in relation to that end of life issue, we've just been successful in securing some free training for professionals within the system around health literacy and increasing health literacy in the way that the NHS and social care communicates with our patients. And the pilot programme is going to be around end of life care. So the 2 hospices will participate, and they will look to become health literate organisations. They'll also work with Leslie Hilton from the ICB and the End of Life Care Partnership, and we're going to try and ensure that that pathway of palliative and end of life care has a health literate approach, which ensures that people understand what is being communicated with them, but that will include things like encouraging lasting powers of attorney, encouraging will writing, ensuring that they make use of the end of life partnerships. I can't remember what they call it, but they have a little card which if somebody is on the end of life pathway, it has their wishes, and it's made very evident to any medical professionals entering the home as to what those wishes are. So it's all about getting that communication right. So hopefully that will help with that, answering that question as well. Thank you. We don't know when that will start, but I'm going to a meeting in a few weeks where the dates will become clear for the training to take place.
Right, you haven't spoken yet. Would you like to introduce yourself?
Good afternoon, everybody. I'm Helen Charles-McVeigh, the Exec Director for Adults Health and Integration at the Council. I suppose there are a few things I wanted to say, more comments than questions. So the first thing, we had a very helpful conversation, presentation from one of our care communities at the Cheshire East Place Partnership meeting on Friday. And the Better Care Fund has put money into care communities this last year to try and test alternative ways of working. And each of the care communities is doing that in the context of its own population. So it's analysed its population, what's important to it. And we had the Bollington, Disley and Poynton care community on Friday, and they have a very elderly population, and they have done a piece of work around end of life and helping people to die in the place that they choose. And there's some really important learning that will come out of that, and it is in part, as in most things, investment of a senior clinician working with individuals, their families, really importantly, but then spending some of their time supporting more junior staff to be able to have those very difficult conversations, and supporting people to be able to make the right decisions. It's one of those occasions on which the paperwork is really important. And that sounds a very odd thing to say, but that paperwork is what will enable any professional turning up at the home to support the person to make the right decision. The absence of that individual's wishes being clearly documented, ambulance service would have to take them to hospital if an ambulance were called. So what I really want to say is that BCF has invested in care communities. We've got a couple of care communities with very elderly populations, and they are testing how we improve end of life support and care for people, particularly where those people have expressed a wish for a specific place to end their life. So I think that's important for us to know. The other thing I was going to say is that the Better Care Fund is going to change. So we have already seen some changes in terms of the planning process for 25-26, but we know that it's likely to see more profound changes during 26-27, and we'll need to transition from the current investments into whatever those new investments need to be, and that might be a bit tricky because we spend a lot of money on discharge and on staff who support that process, including social workers in the council. And the last thing I'm going to say, because I've just said BCF is going to change, is that one of the things we will want to place some emphasis on when we are lobbying government and negotiating with other colleagues is that we know admission avoidance is far, far more effective than facilitating rapid discharge. It's much better to stop somebody going into hospital than it is to help them out of hospital, where that hospital admission was unnecessary. So we welcome the stronger focus on hospital, on admission avoidance, and the shift from focusing on how fast we discharge people.
If I can formally recommend then that this board endorse the Better Care Fund plan for 2025-26. Is anybody willing to second that? seconded by Councillor Stuart Gardner. All those in favour? Any against? And any abstentions? Again, that is carried unanimously. Well, the final item on the agenda today is the local transport plan. Guy.
Yes, this is just for the board's information. The local transport plan draft has recently been published, and there is consultation exercise that is now live. It ends on the 21st of April. The links to all of the consultation documentation were included on the front page of the agenda. And my colleagues in Strategic Highways just asked that I urge individual members of the board and your organisations to have a look at that consultation and respond if you feel it's appropriate. Thank you.
If I could add to that, if you're wondering why that's relevant to the Health and Wellbeing Board, cycling, walking and active travel and exercise in general are massively beneficial to physical and mental health. So the local transport plan in promoting ways of travel can have a significant effect on health, and also the accessibility for communities to get to places. So please do, yes, have a look on the website and respond to that local transport plan consultation. Around the room, unless anybody has anything they wish to say, that concludes the business on the agenda. So thank you for attending today, and I declare the meeting closed.